to the doctor only to be told that your thyroid was just fine. I hear this a lot. In fact, I heard this for years. I heard it from my own doctor. And I went to this doctor for years and years, and I trusted her with my life. But I knew something was up when nothing I did changed the way that I felt. Maybe you're just like me. You went to the doctor. You were poo-pooed or dismissed and told your TSH was in range. In range? Whose range? By the end of this video, you'll get information on the exact tests you'll need to request from your doctor so that you can get the correct diagnosis once and for all. Because maybe, just maybe, you don't have a thyroid problem. But what if you do? What if you're one of the 1 in 5 women walking around America today with a thyroid problem that's not diagnosed? How terrible would that be? That was me for 5 years. Because see, I could do a root cause analysis and pretty much pinpoint the exact tipping point that crossed me over the threshold to having a thyroid disorder. So just don't settle for the gunshot approach. Test, don't guess. Hi there, I'm Maureen Lake, a chronic health expert for ambitious women. It's been a little over a year since I was diagnosed with hypothyroidism and 6 months since I've been diagnosed with Hashimoto's. I had to request and then actually change doctors to get a full panel of thyroid testing done for myself. I was furious. I knew in my gut that there was something wrong, but my doctor just wouldn't listen to me. She poo-pooed me. She dismissed me. She tried to hand me a prescription for antidepressants. I knew that wasn't what my problem was. I followed my gut. So even though I switched to a functional medicine doctor, I still had to request certain tests. That yes, I was diagnosed with hypothyroidism, but then I hit like this wall. I felt like almost like I was in a rubber room trying to claw out, like you see in some of those horror movies, but I wasn't able to penetrate through to get to the other side. That's how tired and sluggish I felt. I went back to the doctor and I requested 2 things. I wanted my antibodies tested and I wanted my iron and ferritin levels tested. Because you see, sometimes you have to advocate for yourself, and that's what I did. And yes, I was diagnosed with Hashimoto's once my antibodies tests came back, and my request for iron and ferritin testing was correct too because I was low in both, which definitely helped explain my massive hair loss that I was experiencing. So why am I telling you all this? Because basically, I don't want you to go through what I had to go through. It wasn't a whole lot of fun. Suffering in silence, being told it was all in your head, when you know in your gut it's not. You start to question just about everything that you do in life because you're riddled with anxiety, panic attacks, your hair falling out, unbelievable fatigue, and like sudden weight gain when you haven't changed your diet at all. It just about ruined my life. And the thing is that the changes are really subtle. It's not like it's some drastic red flag that you can run to the doctor towards and just start saying, hey, listen, there's something wrong here. It doesn't happen that way. So my goal and hope is that all women will take control of this situation if they feel any of the symptoms that accompany hypothyroidism. You need to advocate for your own needs. You deserve it. It's simple as that. So you have everything to gain and nothing to lose by requesting these tests be done for you. The tests that you need to get and ask for in order to get a correct diagnosis is really pretty simple. It's a complete thyroid panel. So if your doctor is taking your routine TSH, why can't he take just a little bit more blood and test for these things? So yes, you do need to have your TSH tested. Because when your thyroid's out of balance, all of your hormones are out of balance, and your thyroid is really the engine that runs your entire body. So the TSH is the most common test done for thyroid disease. And like I said, 1 in 5 women are walking around America right now with it and don't even know it. In fact, 1 in 10 men are walking around right now and don't even know it. It's really great to track and get baseline data on your TSH, because if you're feeling great and your TSH number is at a certain level, you know that's your optimum level. Well, if you start feeling fatigued and all the other symptoms that accompany sluggish thyroid, and your TSH is elevated from your good normal, you will know that something is off. And what do I mean by some of the symptoms? Oh gosh, some of the more common ones are like cold hands and feet, trouble losing weight or gaining weight without any real reason why. You exercise and you're exhausted for 2 days later. Your hair is falling out, or your nails are really brittle and starting to break for no reason at all. Maybe you're constipated or just completely tired all the time. You're so tired that you have trouble getting up in the morning. And then the rest of your day, you suffer from brain fog or even memory issues, and then suddenly you feel like you're depressed. It's a very vicious cycle. So, and the thing with the TSH test results is that the reference range that's being used currently has a 10-point range. That's huge. That's why it's so important to know what your baseline data is for feeling really good and normal. If you're having your TSH tested, why not have the rest of the panel done? What's the rest of the panel? Well, the second test you should have done, the second test that's necessary is called free T3. And what that is the active hormone, thyroid hormone, that actually affects each and every cell in your body. Its job is energy production, hormone producing, and so much more. Your free T3 needs to be at a good place, needs to be checked in order to find out what that good place is, or if it's high or low. The third test you should have done is called free T4. And what this is actually the majority of the thyroid hormones that are produced by your body is actually free T4. And it must get converted to the active T3 free 3 form of thyroid hormone in order for it to work. So this is exactly what happened to me. My test results came back and I'm not able to get my thyroid hormone out of storage and use it actively. I would have never have known that if this panel hadn't been done, and I never would have been prescribed the correct medication if this panel hadn't been done, because there is certain medications for certain reasons according to your blood test. And then finally, get your antibodies tested. Like I said, my first full panel, my antibodies were not tested. I hit that rubber wall, and then I finally had the testing done. And sure enough, this is the only way to diagnose Hashimoto's, which actually, out of all the women in the world that are walking around with a diagnosed thyroid disorder, 90% of them have Hashimoto's. And again, the percentage of women that don't know that is huge. And the outcomes are different, and the treatment is different. So make sure that it's just being tested. They're taking your blood anyways. Make sure that this full panel is being done. So the next time your doctor tells you that you're just fine and your thyroid levels are just fine, request a complete panel. Follow your instinct. Follow your gut. It's your most important tool. And it's a superpower that we have as women. You need to advocate for yourself, because truthfully, your doctor is not going to go down this road unless there's a huge red flag, which oftentimes they're not. There's a lot of subtle changes taking place in your body. So you need to ask for this test being done. Again, if you have any questions, pop them in the chat below, or if you would like to contact me directly, please do. You can reach me at maureenlake.com or email me. I'm happy to talk with you via email or even get on the phone. Email me at maureenlake4@gmail.com. I hope this information helped you in some small way. I know for me, it was huge to learn this information and then to go back to the doctor and actually educate my doctor before I moved to a new one because she wasn't really willing and able to listen to me. I followed my gut, I followed my instincts, and now I have relief, and now I'm working towards complete remission with my Hashimoto's. So please don't hesitate to contact me or give me some questions in the comments below. I'd love to chat. Thank you. See you next time.